Are you experiencing trouble falling asleep at night due to anxiety? Are you seeking a reliable solution for a peaceful and restful night? Look no further than Ativan Tablet, a trusted medication that offers anxiety relief and helps optimize your sleep time. With its fast-acting properties, Ativan Tablet works quickly to calm the mind and relax the body, helping you overcome the barriers to a good night's sleep. Whether you're struggling with anxiety disorders or finding it challenging to relax after a long day, Ativan Tablet can be a game-changer in achieving quality sleep. Ativan Tablet is formulated with proven ingredients to provide the much-needed relaxation and relief from anxiety, allowing you to wake up rejuvenated and ready to conquer the day ahead. Its effectiveness has made it a sought-after choice for those struggling with sleep disorders and anxiety-related issues. Say goodbye to restless nights and embrace the tranquility and calmness with Ativan Tablet. Discover the restorative power of a good night's sleep and the relief from anxiety that has eluded you for so long. Try Ativan Tablet today and experience the transformation it brings to your sleep and overall well-being. Understanding Ativan: what is it and how does it work? Ativan Tablet, also known as lorazepam, is a medication classified as a benzodiazepine. Benzodiazepines are a group of drugs that act on the central nervous system to produce a calming effect. Ativan specifically works by enhancing the effects of a natural chemical in the body called gamma-aminobutyric acid, GABA. GABA is responsible for reducing the activity of neurons in the brain, resulting in a calming and sedative effect. The calming properties of Ativan make it an effective medication for treating anxiety disorders. By reducing excessive brain activity and promoting relaxation, it helps alleviate the symptoms of anxiety, such as racing thoughts, restlessness, and physical tension. Additionally, Ativan can also be prescribed for the short-term treatment of insomnia, as it helps induce sleep and maintain a restful state throughout the night. When taken as directed by a healthcare professional, Ativan can provide relief from anxiety and promote quality sleep. However, it is important to use Ativan responsibly and follow the recommended dosage to avoid dependence or other potential side effects. The importance of sleep: the role of sleep in overall well-being. Sleep is a fundamental aspect of human life and plays a crucial role in maintaining overall well-being. It is during sleep that our bodies and minds undergo essential processes for repair, restoration, and consolidation of memories. Adequate sleep is necessary for optimal physical health, mental clarity, and emotional well-being. During sleep, our bodies repair damaged tissues, synthesize proteins, and release growth hormones. Sleep also regulates our immune system, helping to fight off infections and diseases. Beyond physical health, sleep is vital for cognitive functions such as memory consolidation, learning, and problem-solving abilities. Lack of sleep can lead to impaired attention, decreased productivity, and difficulties in decision-making. Not only does sleep impact our physical and mental health, but it also affects our emotional well-being. Sufficient sleep helps regulate mood and emotions, reducing the risk of developing mood disorders such as depression and anxiety. On the other hand, chronic sleep deprivation can contribute to increased stress levels, irritability, and emotional instability. In summary, sleep is not just a period of rest. It is a fundamental process that supports our overall well-being. By prioritizing and optimizing our sleep, we can reap the numerous benefits it provides, including improved physical health, enhanced cognitive function, and better emotional resilience. Common sleep disorders. Identifying the signs and symptoms. Sleep disorders are conditions that disrupt normal sleep patterns and can significantly impact the quality and quantity of sleep. They can manifest in various ways and affect individuals of all ages. Here are some common sleep disorders and their signs and symptoms. Insomnia. Insomnia is characterized by difficulty falling asleep, staying asleep, or both. People with insomnia often experience daytime fatigue, irritability, and have difficulty concentrating. It can be caused by stress, anxiety, depression, or underlying medical conditions. Sleep apnea. Sleep apnea is a disorder where breathing repeatedly stops and starts during sleep. This interruption in breathing can cause loud snoring, frequent awakenings during the night, and excessive daytime sleepiness. Obstructive sleep apnea is the most common type and occurs when the airway becomes partially or completely blocked during sleep. Restless leg syndrome, RLS. RLS is a neurological disorder characterized by an uncontrollable urge to move the legs. People with RLS often experience uncomfortable sensations in their legs, such as itching, tingling, or aching. These symptoms are usually worse at night and can disrupt sleep. Narcolepsy. Narcolepsy is a neurological disorder that affects the brain's ability to regulate sleep-wake cycles. People with narcolepsy may experience excessive daytime sleepiness, sudden and uncontrollable sleep attacks, and fragmented sleep at night. Other symptoms can include cataplexy, sudden loss of muscle tone, hallucinations, and sleep paralysis. Circadian rhythm disorders. Circadian rhythm disorders are disruptions in the body's internal clock, which regulates sleep-wake cycles. Shift work sleep disorder, jet lag, and delayed sleep phase disorder are examples of circadian rhythm disorders. Symptoms can include difficulty falling asleep or staying awake at the desired times, excessive sleepiness, and reduced alertness. If you suspect you may have a sleep disorder, it is important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan. Identifying and addressing sleep disorders can significantly improve your sleep quality and overall well-being. Ativan for sleep. How Ativan can help with sleep disorders. Ativan Tablet, with its calming properties, can be an effective aid for individuals struggling with sleep disorders. Whether it is difficulty falling asleep, staying asleep, or both, Ativan can help promote a restful night's sleep. Here's how Ativan can help with common sleep disorders. Insomnia. Ativan can be prescribed for short-term treatment of insomnia, especially when it is caused by anxiety or stress. By reducing anxiety and promoting relaxation, Ativan can help individuals fall asleep faster and stay asleep throughout the night. However, it is important to note that Ativan should not be used as a long-term solution for chronic insomnia. Sleep apnea. Ativan is not a treatment for sleep apnea itself, but it can be beneficial for individuals with sleep apnea who also experience anxiety or have difficulty falling asleep due to the condition. By reducing anxiety and promoting relaxation, Ativan can help improve sleep quality and reduce the impact of sleep apnea symptoms. Restless leg syndrome, RLS. Ativan may help alleviate the symptoms of RLS by promoting relaxation and reducing anxiety. It can aid in calming the uncomfortable sensations in the legs and facilitate a better night's sleep. However, it is important to consult with a healthcare professional to determine the most appropriate treatment plan for RLS. Narcolepsy. Ativan is not a primary treatment for narcolepsy. The management of narcolepsy usually involves a combination of medications, lifestyle modifications, and behavioral strategies. However, Ativan may be prescribed in some cases to help manage associated anxiety or to aid in relaxation for better sleep quality. Circadian rhythm disorders. Ativan may be used as a short-term solution for individuals experiencing circadian rhythm disorders, such as jet lag or shift work sleep disorder. By promoting relaxation, Ativan can help adjust sleep-wake patterns and facilitate sleep during the desired times. It is important to note that Ativan should only be used under the guidance of a healthcare professional. They will assess your specific sleep disorder, overall health, and other medications you may be taking to determine the appropriate dosage and duration of Ativan treatment. Dosage and administration, proper usage and precautions. When using Ativan Tablet for sleep or anxiety relief, it is crucial to follow the dosage and administration instructions provided by your healthcare professional. The recommended dosage may vary depending on your specific condition, age, and overall health. Here are some general guidelines for using Ativan. Dosage. Ativan is available in tablet form and typically comes in strengths of 0.5 mg, 1 mg, and 2 mg. The starting dosage for adults is usually 2 mg to 3 mg per day, divided into 2 or 3 smaller doses. However, the dosage may be adjusted based on individual needs and response to treatment. It is important to never exceed the prescribed dosage or take Ativan more frequently than recommended. Administration. Ativan tablets should be taken orally with a full glass of water. The tablets can be taken with or without food, depending on individual preference. It is important to swallow the tablet whole and not crush or chew it. If you are having difficulty swallowing the tablets, consult with your healthcare professional for alternative options. Precautions. Before using Ativan, inform your healthcare professional about any existing medical conditions, allergies, or medications you are currently taking. Ativan may interact with certain medications or exacerbate certain medical conditions. It is particularly important to disclose any history of substance abuse, respiratory problems, liver disease, or glaucoma. Duration of use. Ativan is typically prescribed for short-term use due to its potential for dependence and tolerance. It is important to use Ativan only as recommended by your healthcare professional and not exceed the prescribed duration of treatment. Long-term use of Ativan can lead to withdrawal symptoms and other potential side effects. Tapering off. If you have been using Ativan for an extended period, it is important to gradually taper off the medication under the guidance of your healthcare professional. Suddenly stopping Ativan can result in withdrawal symptoms, including rebound anxiety, insomnia, and irritability. Your healthcare professional will provide specific instructions on how to safely discontinue the medication. It is essential to closely follow the advice and instructions provided by your healthcare professional to ensure safe and effective use of Ativan. They will monitor your progress and adjust the dosage or treatment plan as needed. If you have any concerns or questions about Ativan, do not hesitate to consult with your healthcare professional. Side effects and potential risks. Understanding the potential downsides. Like any medication, Ativan Tablet carries potential side effects and risks. While many individuals tolerate Ativan well, it is important to be aware of possible adverse effects. Common side effects of Ativan may include drowsiness, dizziness, fatigue, headache, nausea, blurred vision, memory problems, slurred speech. These side effects are generally mild and temporary. However, if they persist or worsen, it is important to inform your healthcare professional. In rare cases, Ativan can cause more serious side effects, such as severe allergic reactions, changes in mood or behavior, confusion, hallucinations, or difficulty breathing. If you experience any severe or concerning symptoms, seek immediate medical attention. It is important to note that Ativan has the potential for dependence and abuse, especially with long-term use or higher dosages. Abruptly stopping Ativan after prolonged use can result in withdrawal symptoms, including rebound anxiety, insomnia, tremors, and seizures. Therefore, it is crucial to use Ativan as directed and under the supervision of a healthcare professional. Ativan should not be combined with alcohol or other central nervous system depressants, as this can increase the risk of severe side effects and respiratory depression. Additionally, Ativan may impair cognitive and motor functions, so it is important to avoid activities that require alertness and coordination, such as driving or operating heavy machinery, until you know how Ativan affects you. If you have a history of substance abuse or are at risk of addiction, it is important to discuss the potential risks and benefits of Ativan with your healthcare professional. They can provide guidance on how to safely use the medication and monitor your progress to minimize the risk of dependence. Creating a sleep routine. Tips for optimizing sleep quality. In addition to using Ativan Tablet, there are several lifestyle modifications and habits you can adopt to optimize your sleep quality. Creating a consistent sleep routine can significantly improve your ability to fall asleep and stay asleep throughout the night. Here are some tips for optimizing sleep quality. Stick to a schedule. Try to establish a regular sleep schedule by going to bed and waking up at the same time every day, even on weekends. This helps regulate your body's internal clock and promotes a consistent sleep-wake cycle. Create a relaxing environment. Make your bedroom a sleep-friendly environment by keeping it cool, dark, and quiet. Use blackout curtains or an eye mask to block out any unwanted light. Consider using earplugs or a white noise machine to mask any disruptive sounds. Limit exposure to electronics. The blue light emitted by electronic devices can interfere with your sleep. Avoid using electronic devices, such as smartphones, tablets, and laptops, for at least an hour before bedtime. Instead, engage in relaxing activities such as reading or practicing mindfulness meditation. Establish a bedtime routine. Develop a relaxing pre-sleep routine to signal to your body that it's time to wind down. This can include activities such as taking a warm bath, practicing deep breathing exercises, or listening to calming music. Exercise regularly. Engaging in regular physical activity can promote better sleep. However, it is important to avoid vigorous exercise close to bedtime as it can be stimulating. Aim to complete your exercise routine at least a few hours before bedtime. Limit stimulants. Avoid consuming stimulants such as caffeine and nicotine close to bedtime. These substances can interfere with your ability to fall asleep and stay asleep. Opt for decaffeinated beverages or herbal teas instead. Manage stress. High levels of stress and anxiety can disrupt sleep. Explore stress management techniques such as meditation, deep breathing exercises, or journaling to help calm your mind before bedtime. If necessary, consider seeking professional help to address underlying stress or anxiety. By incorporating these tips into your daily routine, you can create an environment conducive to quality sleep. While Ativan can provide temporary relief, these lifestyle modifications can have long-lasting benefits for optimizing your sleep and overall well-being. Thanks for watching.